Hello, I'm Rachid Sarmi from Bordeaux in France. I am Professor of Public Health at the School of Public Health and INSERM Population Health Research Center of the university. My co-authors and I are also affiliated to the Bordeaux University Hospital or to Institut Bergonié, the regional oncology reference hospital. I'm going to tell you about our paper titled "To Screen or Not to Screen, Reconciling Individual and Population Perspectives on Screening," published as a special article in the November issue of Mayo Clinic Proceedings. Screening is the early detection of a latent disorder with the goal of starting treatment early to improve prognosis or intervening to avoid unwanted consequences of the disorder. From the individual perspective, screening often seems a good idea. First, for many disorders, patients have a better prognosis or a better response to treatment at early compared with later stages. Second, some patients seem late in the disorder process, have a history of previous contacts with health services for manifestations possibly linked to early stages of the disorder. In such contexts, it is logical to hypothesize that an active search for early stages of the disorder should improve the prognosis. Population perspective considers that screening not only is an issue of early interventions for patients with a poor prognosis, but also is proposed to a population that includes people with all forms of the disorder and a majority of people without the disorder. Therefore, a screening recommendation should consider the acceptability and possible negative effects of the process and the perspective of people without the disorder. Too often, the individual and population perspectives are perceived as opposing interests of patients and populations. In our paper, we illustrate how screening is even more complex than usually perceived, and we try to reconcile the individual and population perspectives. We review and illustrate issues and biases that are potential obstacles to the implementation or positive effects of screening and that need to be addressed in clinical trials and modeling of the effects of screening. Beyond classical issues related to the duration of the preclinical phase, performance of tests and overdiagnosis, we underscore issues of selection and acceptability, which are particularly relevant as a majority of people targeted by screening do not have the disorder or do not feel they have the disorder. In our paper, we also discuss applications for research, including an adapted consort checklist for reporting randomized trials of screening. We also explain why modeling can complement randomized trials, especially when the impact of screening must be compared to the impact of alternatives such as improved treatment or prevention. In the final part of the paper, built around its figure 3, we list 7 questions for which evidence must be provided before screening can be implemented. We then submit that screening is unethical if treatment during preclinical phase is not shown to be superior to later treatment, if advantages of screening for the target population are not shown to be larger than its disadvantages, or if screening is not shown to be acceptable to all individuals with or without the disorder. In conclusion, screening is an important public health intervention for which the individual and population perspectives can be reconciled. Many obstacles are well documented and apply equally to both perspectives. The individual and population perspectives can both benefit from stronger emphasis on an evidence-based model of screening in which scientific evidence, the experience of physicians, and the values of all individuals, whether they have or do not have the targeted disorder, are considered. In that perspective, the experience of physicians is that most tests are negatives, most positive tests are false positives, and screening-related morbidity can be frequent. Thus, the acceptability of individuals must always be considered. Thank you for your attention.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.